This presentation by the Heart Innovation Research Program Team is about how to use the online screening tool called the Prodromal Symptom Screening Scale, or the PSSS. A prodrome is a symptom or set of symptoms that precedes the standard clinical presentation of a disease process. In cardiovascular disease, cardiac prodromal symptoms can precede the onset of acute coronary syndrome. In the literature, a number of prodromal symptoms have been identified, such as shortness of breath, nausea, fatigue, and chest discomfort, as well as less recognized symptoms such as lightheadedness, pins and needles, unexpected headaches, acute insomnia, new or unexpected anxiety, unusual sweating, abnormal sensations of hot and cold, arrhythmias, and pain in unusual places. Unique to acute coronary syndrome, prodromal symptoms may be experienced days, weeks, or months prior to a seminal cardiac event. Presentation of prodromal symptoms vary in terms of intensity and frequency, and often are transient in nature and therefore hard to recognize as cardiac in nature. Up to 92% of individuals presenting with acute coronary syndrome report experiencing prodromal symptoms. Systematic reviews indicate that among individuals with prodromal symptoms, most frequently reported were unusual fatigue, shortness of breath, gastrointestinal complaints, and anxiety. Retrospective studies have observed rates of missed acute myocardial infarction and missed acute coronary syndrome diagnoses as ranging from 0.9% to 5.3% in North America. There's evidence that patient-reported symptoms are able to improve predictive probability of an ACS diagnosis, especially in the emergency department. Thus, it is imperative as a healthcare provider to accurately assess all possible prodromal symptoms when acute coronary syndrome is suspected. To address the need for prodromal symptom screening, the Prodromal Symptom Screening Scale was devised. Looking at 13 different prodromal symptoms as well as known risk factors, the Prodromal Symptom Screening Scale assigns a level of symptom urgency leading to development of acute coronary syndrome. The levels are stratified as low urgency, moderate urgency, and high urgency. When to use it. The Prodromal Symptom Screening Scale should be used on any patient at risk for acute coronary syndrome, or whom you expect acute coronary syndrome events may be occurring in. This tool can be used in the outpatient setting by teaching at-risk patients how to use the online web tool and encouraging regular use of the tool. Results from the Prodromal Symptom Screening Scale can be emailed directly to providers for review. Giving patients a vehicle by which they can discuss their health concerns can enable patients to become more involved and proactive in their health care. The 13 symptom checklist can also be printed out and used in the inpatient setting to screen at-risk patients for all potential prodromal symptoms. Screening results can alert the healthcare provider of the need for proactive cardiovascular workup and risk factor profile management. Where to find it? You can find the scale at catchheartdiseaseearly.ca or sokeefemccarthy.ca under Resources. You can access it on a computer or mobile device. How to use it. After accessing the website, you can access the PSSS by clicking Go to Scale. Whether taking the scale yourself or completing the scale with your patient, click on Use the Scale. The PSSS will begin by asking you questions about your 13 prodromal symptoms. Follow the prompts to answer these questions. Following the prodromal symptoms, the PSSS will require you to fill out a risk factor profile. This will include things like BMI and waist circumference, and some sex-specific characteristics such as gestational diabetes or gestational hypertension. Then, the PSSS will generate a report and simultaneously generate an alert. This alert can either be green, yellow, or red, based on the level of urgency. The report that is generated can be downloaded and filed away. This report can then be used to track changes in your patient's symptoms and cardiovascular health. The alerts can be green, specifying low urgency. An orange alert indicates that your patient has identified a moderate level of prodromal symptoms that are concerning and will require cardiovascular follow-up and risk factor profile management. A red alert indicates high urgency, which is a high level of symptom urgency in combination with risk factors and will require immediate cardiovascular workup. For more information, you can go to Behind the Research or to sokeefemccarthy.ca. Thank you for watching this video. For more information, visit sokeefemccarthy.ca.